If you have high blood pressure, you may wonder if medication is necessary to bring the numbers down, but lifestyle plays a vital role in treating high blood pressure. Controlling blood pressure with a healthy lifestyle might prevent, delay, or reduce the need for medication. High blood pressure, also known as hypertension, is a prevalent global health concern, affecting approximately 1 in 4 adults around the world. This condition places individuals at a higher risk for serious cardiovascular complications, including heart disease, stroke, and kidney problems. Given its widespread prevalence, efforts to raise awareness about the importance of regular blood pressure monitoring and lifestyle modifications have become increasingly vital. By encouraging healthy habits such as maintaining a balanced diet, engaging in regular physical activity, and managing stress, individuals can take proactive steps towards preventing and managing high blood pressure, ultimately promoting better cardiovascular health and overall well-being. Welcome back to our channel. I hope you like our video and kindly don't forget to subscribe to our channel. Here are 8 lifestyle changes that can lower blood pressure and keep it down. Number 1. Lose extra pounds and watch your waistline. Blood pressure often increases as weight increases. Being overweight also can cause disrupted breathing while you sleep apnea, which further raises blood pressure. Weight loss is one of the most effective lifestyle changes for controlling blood pressure. If you're overweight or have obesity, losing even a small amount of weight can help reduce blood pressure. In general, blood pressure might go down by about 1 millimeter of mercury, mmHg, with each kilogram, about 2.2 pounds of weight lost. Also, the size of the waistline is important. Carrying too much weight around the waist can increase the risk of high blood pressure. In general, men are at risk if their waist measurement is greater than 40 inches, 102 centimeters. Women are at risk if their waist measurement is greater than 35 inches, 89 centimeters. These numbers vary among ethnic groups. Ask your healthcare provider about a healthy waist measurement for you. Number 2. Exercise regularly. Regular physical activity can lower high blood pressure by about 5 to 8 mmHg. It's important to keep exercising to keep blood pressure from rising again. As a general goal, aim for at least 30 minutes of moderate physical activity every day. Exercise can also help keep elevated blood pressure from turning into high blood pressure, hypertension. For those who have hypertension, regular physical activity can bring blood pressure down to safer levels. Some examples of aerobic exercise that can help lower blood pressure include walking, jogging, cycling, swimming, or dancing. Another possibility is high-intensity interval training. This type of training involves alternating short bursts of intense activity with periods of lighter activity. Strength training also can help reduce blood pressure. Aim to include strength training exercises at least 2 days a week. Talk to a healthcare provider about developing an exercise program. Number 3. Eat a healthy diet. Eating a diet rich in whole grains, fruits, vegetables, and low-fat dairy products and low in saturated fat and cholesterol can lower high blood pressure by up to 11 mmHg. Examples of eating plans that can help control blood pressure are the dietary approaches to stop hypertension, DASH diet, and the Mediterranean diet. Potassium in the diet can lessen the effects of salt, sodium, on blood pressure. The best sources of potassium are foods, such as fruits and vegetables, rather than supplements. Aim for 3,500 to 5,000 milligrams a day, which might lower blood pressure 4 to 5 mmHg. Ask your care provider how much potassium you should have. Number 4. Reduce salt, sodium in your diet. Even a small reduction of sodium in the diet can improve heart health and reduce high blood pressure by about 5 to 6 mmHg. The effect of sodium intake on blood pressure varies among groups of people. In general, limit sodium to 2,300 milligrams, mg, a day or less. However, a lower sodium intake, 1,500 milligrams a day or less, is ideal for most adults. To reduce sodium in the diet, read food labels. Look for low-sodium versions of foods and beverages. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. Don't add salt. Use herbs or spices to add flavor to food cook. Cooking lets you control the amount of sodium in the food. Number 5. Limit alcohol. Limiting alcohol to less than 1 drink a day for women or 2 drinks a day for men can help lower blood pressure by about 4 mmHg. 1 drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80-proof liquor. But drinking too much alcohol can raise blood pressure by several points. It can also reduce the effectiveness of blood pressure medications. Number 6. Quit smoking. Smoking increases blood pressure. Stopping smoking helps lower blood pressure. It can also reduce the risk of heart disease and improve overall health, possibly leading to a longer life. Number 7. Get a good night's sleep. Poor sleep quality. Getting fewer than 6 hours of sleep every night for several weeks can contribute to hypertension. A number of issues can disrupt sleep, including sleep apnea, restless leg syndrome, and general sleeplessness, insomnia. Let your healthcare provider know if you often have trouble sleeping. Finding and treating the cause can help improve sleep. However, if you don't have sleep apnea or restless leg syndrome, follow these simple tips for getting more restful sleep. Stick to a sleep schedule. Go to bed and wake up at the same time each day. Try to keep the same schedule on weeknights and on weekends. Create a restful space. That means keeping the sleeping space cool, quiet, and dark. Do something relaxing in the hour before bedtime. That might include taking a warm bath or doing relaxation exercises. Avoid bright light such as from a TV or computer screen. Watch what you eat and drink. Don't go to bed hungry or stuffed. Avoid large meals close to bedtime. Limit or avoid nicotine, caffeine, and alcohol close to bedtime as well. Limit naps. For those who find napping during the day helpful, limiting naps to 30 minutes earlier in the day might help nighttime sleep. Number 8. Reduce stress. Long-term, chronic, emotional stress may contribute to high blood pressure. More research is needed on the effects of stress reduction techniques to find out whether they can reduce blood pressure. However, it can't hurt to determine what causes stress, such as work, family, finances, or illness, and find ways to reduce stress. Try the following. Avoid trying to do too much. Plan your day and focus on your priorities. Learn to say no. Allow enough time to get done what needs to be done. Focus on issues you can control and make plans to solve them. For an issue at work, talk to a supervisor. For conflict with kids or spouse, find ways to resolve it. Avoid stress triggers. For example, if rush hour traffic causes stress, travel at a different time or take public transportation. Avoid people who cause stress if possible. Make time to relax. Take time each day to sit quietly and breathe deeply. Make time for enjoyable activities or hobbies, such as taking a walk, cooking, or volunteering. Practice gratitude. Expressing gratitude to others can help reduce stress. In conclusion, understanding the critical link between lifestyle and high blood pressure is crucial. While medication may be necessary for some individuals, embracing a healthy lifestyle can significantly impact blood pressure levels. By focusing on weight management, engaging in regular exercise, and adopting a nutrient-rich diet, individuals can proactively mitigate the risks associated with high blood pressure. Reducing salt intake, limiting alcohol consumption, quitting smoking, and prioritizing quality sleep also play pivotal roles in maintaining cardiovascular health. Additionally, stress management is essential, as chronic stress may contribute to hypertension. Making these lifestyle adjustments not only aids in preventing and managing high blood pressure, but also enhances overall well-being. As we wrap up, remember to prioritize these strategies for a healthier and more balanced life. Thank you for watching, and don't forget to subscribe to our channel for more valuable health-related information.